Hey guys, this is Brittbratt coming at you on Friday, July 1st, 2016 with my 18-week post-op vertical sleeve gastrectomy update. I hope all of you guys are doing very well on this Friday and holiday weekend. For us, it's gorgeous outside. I know in the east, you guys are getting some pretty big rains right now, so take care. Let me get started. I had vertical sleeve gastrectomy surgery on February 24th, 2016 in Chicago, Illinois at Northwestern Memorial Hospital under Dr. Jeffrey Fronza. My highest weight before surgery was 320 pounds. On the day of surgery was 296.6 pounds. Last week I came at you at 219.9, which put me at that 100-pound loss mark, which is fantastic. And this week I am 214.8. That puts my B at 36.9, and I am 5'4", just in case you'd like to know. And it gives me a week loss of 5.1 pounds. Damn! A total loss of 105.2 pounds. And from day of surgery, 81.8 pounds. I don't know why I lost 5 pounds, you guys. I don't know why, but I did. So there we go. Can't even give you a reason. Actually, I could give you a reason. I think the reason that I lost 5 pounds, 5 pounds, is because I'm finally able to eat normal again. Yay! I told you guys, like last month, I had my period. The week before my period, I ate like a crazy person. And then 2 weeks after, including the week of my period and the week after, I ate very minimally. I was sick whenever I ate. I could barely get anything in. My pouch was very tight. I had severe restriction. I was maybe able to get 1 ounce to 1.5 ounces of food in a sitting. It was almost nothing. I was almost eating nothing. So my calories were really low, and I was really struggling to get calories in for like 2 weeks straight. So finally this week, I am finding that I can get calories again. I'm hitting like 850 to 950, which is fantastic, which is why I think the weight moved, because finally I'm able to get my calories in again. So I'm very happy with that it's finally going again. So I think that's why I dropped the 5 pounds, because the week of my period I dropped 2, the week after I dropped 3, and this one was 5.1. So and I think that's why, because I was able to eat more. So that's great news. I'm glad I'm able to get in there. However, next week is my period. I have exactly 7 days until my next period, which means I am breaking out, and we will see how the eating goes this week, because last month I ate like crazy the week before my period, and I may do the same thing. But like many of us know, and I'm only 4 months out, your periods are completely insane your first like 6 months. I've even heard 8 months out that your periods are completely irregular and weird. And so I have not had anything consistent since I had the surgery and since I had my IUD put in November. So I don't think the IUD affects it as much anymore. I think the IUD keeps it short and simple, or supposedly. But I've been having like 2-week-long periods with spotting in between. So I don't know what the IUD is supposed to do yet, because it hasn't done it yet, apart from keeping me, with birth control, basically. So, yeah, I don't know what this month is going to entail, but we will find out. I know I'm breaking out, which is about a normal thing for me. Right before surgery, I break out like a crazy person. So everything is normal so far. Now we'll see how my eating is this week. So, yeah. I have been noticing I'm a little bit more snacky. So, that's the start. Okay, so I'm glad the restriction is down. As far as my diary, like my food diary and stuff, I have MyFitnessPal, and you guys are more than welcome to friend me on MyFitnessPal. I put my information in the description box down below for MyFitnessPal and FitBit and all those things that I use, Facebook, Instagram, things like that. So by all means, feel free, if you really want to see my diary, see what I eat in a day, go ahead and friend me, and you can take a look. My diary is an open book. The only thing to keep in mind is that when you look at breakfast and you see like 20 things in there, it's not because I eat 20 things during breakfast. It's because I eat 5 times a day, and I eat like every 3 hours, and I put like multiple meals in like one category, because they don't have a section where you can split it to 5 if you have a free membership. So I usually sometimes will put like lunch in breakfast, or I'll put like my second or third dinner in like, lunches or something. So it can look a little weird, but at least you can get the gist of what I eat, at least the different types of things, to give you ideas on what maybe you would like to eat. I look at other people's diaries on MyFitnessPal because I like to get ideas of what to eat, things like that. Okay, as far as exercise is concerned, I'm doing the same thing I normally do. However, this week was a little bit slower, so I decided to do, I have an app on my phone called Nike Plus training. And I've had that app for a very long time. I used to use it about 5 years ago. Loved the heck out of it. It's calisthenics. It kicks your ass. It's fantastic. You do like a 30-minute to 45-minute workout and it kicks your butt, seriously. The only problem is that in the summer, and I've mentioned this before, about I can't do weight training because I have to walk a lot and work a lot. And so when I did this 30-minute kick my ass workout on whatever day it was, I couldn't function like the 2 days after. For the day of, like I went out and ran that night, or did my C to 5K that night. So I was fine that night. It was the next day and the day after, maybe possibly the day after that I was really sore. And at work, I just can't do that. Like it's all hills in the summer and I need to walk like a ton. And that day it was a 12-hour shift. So that's like 6 to 9 miles. And I only got 3 miles in because I was so broken down from that, from the squats and stuff. So that was bad news bears, and this is also another reason why I want to wait till the winter to do any kind of strength training, because in the winter I don't walk a lot because it's Wisconsin. Everything freezes, everything snows, and everything is effing cold. Sometimes -30, -40, perfectly normal in Wisconsin for winter. So that happens, and I don't go walking when it's -50 degrees. I don't walk 12 miles in -50 degree weather. Sorry, don't do it. So I can strength train because all I do is sit around in the truck at work and drive around and sit at my desk. So it's easier. I can be sore in the winter. So I have to remember to put that off, put a pin in that, put a pin in it, and stop dicking around with that kind of crap. So that was super fun. Lesson learned. Check. Also, I went to the chiropractor on Thursday and she gave me a little bit of adjustment. I got hip issues and I got a numb spot on the back, on my like the middle of my back, on the upper back, like right by my shoulder blade. It's really weird and it's consistently in that spot. So I know it's not MS because my sister has that, so I'm pretty well acquainted with it, and I know that's not it. So that's just a pinched nerve. So I went to the chiropractor to see if she could do anything, and she did. She adjusted me, and I'll see her next week too, but she suggested I go to a massage therapist. So I may be getting a massage very soon to work out some tightness up in my shoulders and my neck, and maybe in my hips too, because they're jacked from my pregnancy. So we'll be doing that. Check. I wasn't planning on getting a massage anytime soon, but then I was thinking about it. I'm like, I deserve one. I am super sore, and I bust ass like every day. Walking. Okay, walking, running, that whole bit. Biking. So that will be done. And then the last thing I want to discuss is called the perfect WLS patient. I'm going to try to make this video short because I have like other videos to do. So the perfect WLS patient is this fairy that exists that shoots rainbows from its butt, and it's a unicorn, and it's gorgeous to look at, and they never eat anything wrong, and they are just perfect. And this is who we all think we're going to be before we have surgery, or at least some of us do think that. Some of us think that before we have surgery, or we immediately after, that we will never ever do anything wrong, that those people who are out 4 months or more than that, or a year or two, that are eating those things are doing a horrible job. And why would they have the surgery? Just to mess it up and eat those naughty things. And that is something that is a very common thought before surgery or right after, or even a month after. It's just a common theme. However, this magical fairy of a person doesn't exist very frequently. I'm not saying they don't exist, because we all know of the magic fairy pregnant lady. The pregnant lady who looks gorgeous and looks completely pregnant. She's got a big old round belly and thin everywhere else, and she doesn't gain much weight. She doesn't have flatulence problems. She can still work out, and she doesn't have back issues, and she can wear heels and a short skirt, and she looks great. That's the magic fairy pregnant lady, just like the magic fairy WLS patient person. I'm not saying they don't exist. I'm just saying it's a very rare sighting. Somebody who has weight loss surgery and never eats anything wrong ever. Well, that's not very frequent. Even the best weight loss surgery patients fuck up. And that's something I want to bring to your attention, or to anybody who's thinking about having the surgery or freshly out. You will fuck up. It's okay to fuck up. It is human. It is innately human to fuck up. It's okay. to make mistakes. And do not judge other people for making them, because that is human. It is completely human and normal to make mistakes. In fact, it may be seen as beneficial to make mistakes. We learn from our mistakes, so it's a good thing to learn from your mistakes, to see what effects these things have. You can't fix yourself if you're never going to address the problem. And sometimes addressing the problem means you have to make a mistake to identify that problem. Shit, when I have 2 bags of chocolate, I gain weight. I shouldn't eat 2 bags of chocolate anymore. Instead of completely abstaining it and never realizing that that's an issue that you have. That's a problem, because then eventually when it does happen, you're gonna be upset. You're gonna be really upset, especially if you think that you'll never make that mistake. So just realize when you're coming into the surgery, when you're sitting there and judging other people for things that they eat or things that they do, that you think you'll never do that, it's very unlikely that you'll never make a mistake with this, okay? One thing to realize is that you are having the surgery because you have an eating issue. And the surgery doesn't change your brain, it changes your stomach. It changes your anatomy. It doesn't flip the psychological switch in your brain that's attached to food. So if you want to try and identify, and one of the best things to do is to go to a psychologist or a shrink or a counselor, whatever you want to call it, to identify your triggers or to figure out exactly why you became big in the first place, that would be a good place to start, because then you can address why you eat the way you eat, why you eat the things that you eat, why you eat them when you do eat them. You know, why do you eat that much? Is it a stress thing? Is it a bored thing? Is it a addiction thing? Like, what is it? And that's a good thing to address, because we all have something that is causing this. To say that nothing is causing you to be obese is silly. It's not. It's beyond you that you're obese. I think that's also a little weird. Now I do know that there are health issues that get people to where they are at. So I'm not saying that in all cases it's a psychological thing. Sometimes it is a physical thing, for sure. I know people with asthma who the medication for the asthma and stuff makes them bigger, and I know thyroid issues will cause you to be bigger as well. So I'm not saying that there aren't physical things that go along with it, but there are also a lot of psychological things that are attached to food. So just keep that in mind when you get the surgery done, that this isn't a cure-all. Getting the surgery doesn't mean that automatically you're great at eating anymore. It just means that you got the surgery to help guide you. It's a tool. It's not going to do the work for you. You still have to do the work, and you're not going to be perfect. So I'm just going to throw that out there. It's something that I think about when I watch a lot of newer videos. It's something that has come to my attention a few times before. And just remember to not be so freaking judgy for other people, because people will do what they want to do. And the best thing you can do is support them rather than judge them. I don't think that you sitting there and judging, it makes you look good or helps them out at all. So anyways. That's my little rant, you guys. I'm going to be doing 2 more videos this week, so get ready for that. I'm going to do my skin flick, which I was supposed to do last week and completely skipped over, but I will be doing that for sure tomorrow. And then I have to do, I'm thinking about doing a response video to Finding Elizabeth or The Naked Truth. She asked people to do a response video of their naked truth, so you guys should get on it too. And she wants it done by, I think, next week Thursday or July 7th or something, I think. I don't know. Anyway. However, it's a deep topic, and I haven't done one yet because I really have to think about it. Sleevy Nicks put one out. I think that's her thing. Sleevy Nicks put one out. And I just have to think about it, because it is very deep to think about your naked truth. Like, that's just something I have to think about. So, I do plan on doing it, so I hope you guys do it as well, and I hope you guys have a great 4th of July weekend. Happy, I think it's Canada Day, to the Canadians up north, and you guys enjoy your weekends. I'll talk to you soon. Bye.